Hello, I am David Cade, the CEO for the American Health Law Association. Each year, the Board of Directors approves a slate of esteemed individuals selected by the Fellows Coordinating Council as AHLA Fellows. These longtime members have shown a commitment to the association through their participation as speakers, authors, mentors, and leaders. They are regarded as one of the top health law professionals in the legal community, and all have been actively participating in AHLA and the health law profession for 15 or more years. While the bios for these fellows are posted on AHLA's website, it is just a snapshot of their many accomplishments. I want to give you the chance to hear from them personally and learn more about why they deserve the Fellows honor. The 2022 Fellows class includes 7 exceptional individuals. Today, I have the distinct honor to be speaking with Lisa Hathaway. Lisa, hi, how are you today?
I'm great, David.
Well, it's great to have you with us and to share, and so we'll go ahead and get started. How does it feel to be an AHLA Fellow?
I am extremely honored. It was probably one of my best honors in addition to being elected a board member in the past. So it was a great achievement.
Well, and an honor very well deserved. And so I want to take us back a little bit and to start perhaps at the beginning. Why did you go to law school and why did you select health law as a career area?
Well, I have an interesting story. I did it by accident. I was a nurse first and was working on my master's. I almost went to med school and didn't want to go spend 4 years in med school, a year of classes I needed from nursing, and 5 years of residency. And I reviewed some cases for some lawyers and I became fascinated with it. And so I thought, well, I'll apply to law school. And I got in these law schools and I studied, took my LSATs and did really well. And I remember telling my father, I think I'm going to go to law school. There's no lawyers in my family in any side of it. And he goes, well, that makes sense. He goes, that'll fit your characteristics well.
And
so I stumbled into it, but you know what? I've always combined, and I continue to use my health law today. And I've used that throughout my entire career.
And I imagine that clinical grounding gave you a deeper understanding, not just in law school, but in your career at that intersection.
It has. It always has. I mean, the law school was a little struggle at the beginning because I didn't have all the poli-sci classes, but you know, you learned. But every job I've had, I've used my health law, you know, my law with the health, and it's worked out wonderfully. And the physicians and nurses I've interacted with, at least I can talk the lingo or I understand where they're coming from. So it's been very beneficial.
Great. And so coming forward a little bit, how has AHLA helped you remain connected with your health law colleagues?
I would say it's the biggest factor in my career, being connected with American Health Lawyers. I was involved with another organization and it just only for a short time wasn't meeting my needs. And I heard about American Health Lawyers and I remember going to it, and I've been highly involved since. And I've done the same thing that folks did with me is people took me under their wings and, you know, gave me the ropes and got me involved. And I still remember the person I gave my first seminar with, Alan Chavez, and how we worked together. And, you know, he had given several presentations and I've done the same thing. For example, I took Mark Hobson under my wing and everybody knows how well Mark has done, and Todd Ebersol. So I played it forward, sort of like the cup of coffee at Starbucks.
Well, in fact, yes, you have played it forward, and those folks are outstanding colleagues and friends of AHLA. So it leads me to this next question. If a new AHLA member asked you how to get involved in the association, what would you tell them?
Several things. Don't be afraid to reach out, go to meetings, especially the wonderful educational meetings American Health Lawyers offers. Volunteer, write an article, edit an article, get involved with a practice group. There's just so many ways. Everybody, you know, has certain amounts of time and involvement, but start small and work your way up.
So now thinking back, this is my Groundhog's Day question. If you could give your younger self one piece of advice, what would it be?
Wow, that's a tough one. You know what? It's advice I've always tried, and it's hard to achieve, but it's balance. But you also have to be involved, and I think it's the one thing I worry about today is in today's world where everybody works from home and doesn't go to many in-person meetings, connections are so important. Getting to know colleagues, getting to know people, and figuring out in today's environment how you get connected. And there's nothing like a one-on-one or having a lunch with a group of people or going to an educational session. And I don't want people to lose sight of that. So it's been helpful to me. And I know a lot of my colleagues that are in my age frame. And it's what I worry about most for my staff that are mid-level attorneys and senior attorneys.
Yeah, and so now we're walking forward a little more. And as you look back over your career, and I know you're not done, I know you're still actively involved, and we appreciate it. We benefit from it, and so does the health law community. But I wanted to pause and give you a moment to share with us what has been the accomplishment that you are most proud of and why?
Probably giving back and teaching people, whether it's through educational sessions or growth and mentoring my mentees out there or my staff. Actively grooming my staff so when I take over, they can continue. You know, one of them can have my position. You know, Medicare is what my current position is, and I support all of Aetna's Medicare legally, and it's complicated, and it takes a long time to really learn the ins and outs and really be able to know what rock or what braid will work. And, you know, so giving back that way, which is why I still like to give presentations as much as I can.
You have a very giving heart. And in fact, you know, perhaps not quite the last nugget for today, but a nugget I'd like to have you share a little more about is, you know, what would you say are the traits you feel are the most important in being an effective health lawyer?
In today, continued growth, partnership, listening, continuing to do a ton of reading. And, you know, you build upon each layer. Law has gotten so complex and so specialized. And, you know, I think being patient. I know some of the new generations aren't as patient, and it takes a while to learn all of this.
Yes, patience, an inquisitive mind, a lifelong learner, read and consume what's out there, listening, all good messages, all good traits. And I'm hopeful as folks new to the profession watch this video, they truly ingest those key traits. I totally agree with you, Lisa. So I want to end with this one. You know, as you talk about the world we live in today, how hard it is, how busy everyone is, as we strive still for that work balance, that life balance, what do you do for fun? How do you unplug and balance, Lisa Hathaway?
I work out pretty much every day, and I have found in my current position, the best time is early in the morning. So I get up about 5:30 and I have 3 hours to myself. I strive not to start a meeting till 9. Sometimes I can't control that, but those are my 3 hours just to work out, walk my dog, just do some thinking, relax, because sometimes at the end of the day it's not controllable and I've got a lot of meetings running till late. But it's so important that you find time, you know, or take a break and meditate for 10 minutes in the middle of the day, or get up from your chair and take a walk around the house or around the office or outside. You've got to, and I tell my staff to do that. They have something they taught us with this Thrive app. You go like this, you know, it's a way to meditate. If you're stressed, you can, there's different techniques everybody can develop.
So I'm going to take a walk after this. I haven't this morning. So yes, Lisa, you were always an inspiration to me and many others. And yes, getting up and just jumping on the computer, not always the healthy way to go. I'm going to take that walk. You have just given me more inspiration to make the time.
You have to clear your mind, David. And it sounds like you understand that you know what, laws, it requires a lot of thought, thinking, it's stressful, but you'll be a better thinker, even if you take a short break. But everybody's got different cadences or when they are best working out or taking a break, but you just have to work that into your schedule and you make it like a meeting with yourself. It's important.
Well, I would say I would invite anyone taking a moment to watch this to take a break before you pick up your next pencil, your next task, keep hands on the keyboard. Let's follow Lisa's lead and invest a little time in ourselves. Lisa, I want to thank you so much. Congratulations again on this honor, well deserved. We are so grateful that you have continued to commit and share with AHLA and the extended health law community. So thank you again.
I want to thank you and the association, and for those that are going to listen, get involved, and it's one of the best things you can do for your career.
Great. Thank you, Lisa.
Thanks, David.